Hello, welcome to this session on supporting safety in care homes, looking at tools to help spot the early signs of serious illness. My name is Jeff Cooper. I'm a nurse and a quality improvement coach with Western Patient Safety Collaborative. I'm here to talk about Restore 2 and Restore 2 Mini, the soft science version of the tool. Restore 2 is a physical deterioration and escalation tool for care and nursing homes. It's designed to help support carers to recognise deterioration, to act appropriately, to obtain a complete set of observations, to speak with the most appropriate healthcare professional and provide them with an escalation history. Deterioration, including sepsis, is often recognised late, sometimes too late, and that can have life-changing consequences. But what if we could identify it sooner? In the hospital, in the emergency department, in the ambulance, at the GPs, or in the preceding days in the care home? And what if we all spoke the same language and could communicate our concerns better, using methodologies like soft signs, News 2, SBARD? So how does Restore 2 work? There's 5 key components. It starts with early recognition of deterioration using soft signs, relating those to what's normal for the individual concerned, and then using the National Early Warning Score to take and to record the observations. To escalate the concerns using the thresholds in the news score, and then to use a structured communication tool like SBARD to help you get your message across. This is what Restore 2 looks like. It's 6 sides of A4. The first 2 are about the soft signs and Restore 2, end-of-life care, escalation thresholds. There's then two pages for the news escalation score, and then the final 2 sides on the SBARD escalation tool and action tracker. When we're looking at the management of deterioration in care homes, it's important to take account of the residents' own preferences. We need to think about what they would like to happen if they become unwell. This might include having a treatment escalation plan, an advanced care plan, an advanced directive. There's a number of terms used. So what are the benefits arising from using a tool like this? Well, there's many. Firstly, looking at 999 calls, the original pilot project team found that the nursing homes using Restore 2 decreased their use of 999 calls by more than 8%. At the same time, the residential homes noticed a drop in 999 calls of over 31%. For the same time period, nursing homes not using a deterioration tool increased their use of 999 calls by over 1.5%. And whilst there was a drop in residential care homes, this was a much smaller drop of around 14%. Now, whilst financial savings were estimated at the time, these are really proxy measures for inappropriate care. It's important to realise that Restore 2 is not about admission avoidance, it's about appropriate care, about the right care in the right time, at the right place, with the right outcome. Staff reported that the use of a tool like this raised their awareness of deterioration. It helped them track the clinical condition, and it increased their use of monitoring and observations. 5% of staff felt it made no difference, but that was basically because they felt they already had the skills. It wasn't that the tool wasn't useful. Staff felt the escalation protocol helped when talking with healthcare professionals. They felt it helped identify why they were escalating their concerns about that particular patient, with over 87% of staff reporting a positive use of the tool. And they also felt that the SBARD tool itself helped, that it helped them provide more concise and focused information with the right level of detail and with a reduced need for repetition. Again, a similar number of staff felt it made no difference, again, mainly because they felt they already had those skills. Over 57% of staff felt it helped them engage with the GP on the first immediate telephone call. And 100% of them felt it helped them achieve a home visit in the same day. And overall, over 69% of staff felt that admissions were being avoided due to earlier intervention with simpler treatments, hydration, oral antibiotics, rather than a hospital visit and intravenous antibiotics. We've produced a number of resources to support the use of these tools. These are all available from the YouTube channel, the Health Education England's YouTube channel. They're all short, around 3 minutes, and they all look at specific aspects of care. So taking your blood pressure, taking oxygen saturations, what is deterioration, what is the news score. 7 of those videos have also been refilmed for the learning disability community. And the links will be available in the slides that you get after this presentation. You don't need to write them down now. Equally, we've all provided, there's a number of places you can get these resources from, including the Wessex Patient Safety Collaborative website. We've got a page on Restore2. The West Hampshire CCG website, you can get all the materials, the original tools, because they own the copyright and trademark. You can get the materials directly from them. And then there's a page on the AHSN Network's website about all the work they've done on patient safety during COVID. We've also done a page on using soft signs to identify early indications of physical deterioration. And we've written a paper on the subject. Again, the hyperlinks will all be available when you get the slides. Restore2 has been recommended by the British Geriatric Society as part of their managing the COVID-19 pandemic in care homes. And it's also been adopted and recommended by the Learning Disabilities Mortality Review, the LEADER programme. It's also run a number of awards, the HSJ Awards for improving the management of deterioration, and it's won an award from the Parliamentary Award for Excellence in Primary Care. So where does Restore2 Mini fit in? Restore2 Mini focuses on the use of soft signs in areas that don't want to use a medicalised model. So it takes up the news score and the escalation based on the news score. So it focuses on the use of soft signs for the early recognition of deterioration, comparing that with what's normal for the individual, and escalating concerns and getting your message across using the SBARD communication. Soft signs are a whole nother subject in their own right, and my colleague Sandra in her next session will talk more about these. But suffice to say for now, they can be physical, mental and behavioural, and they're listed here and included. There's also a handbook that's another resource to support the rollout, and these are covered in more detail there. This is the tool itself, so it's much simpler than the Restore2 tool. It's 2 sides of A5, although there is an A4 version for those who want it. There's the soft signs on the one side of the card, and then the SBARD communication prompts and a record of the call on the other side of the card. We've customized the tool for use in other care settings. There's a version available for domiciliary care, which uses the terminology of home and clients rather than care home and residence, and another version for use in your learning disability care setting, which uses the terminology of the person you support. There's no other changes. The soft signs are the same, and the SBARD methodology is identical. It's just those terms that make it more appropriate for each of the care settings. Similarly to the Restore2 pilot, the domiciliary care pilot project team identified some very similar benefits around more appropriate care, that's to say in accordance with the client's preferences, improved local management, and also improved staff confidence relating to the awareness and use of soft signs and SBARD, as well as the recognition and response to physical deterioration. Interestingly, they also identified greater engagement with the clients and their families, as well as improved communication between healthcare professionals. These quotes support those bullet points. The qualitative analysis supported the bullet points, and it all basically identified the simplicity of the tool and the benefits arising to all concerned. In summary, the feedback clearly demonstrated numerous benefits arising for many of the people involved, and suffice it to say, all 4 of the provider organisations involved in the pilot took up the use of Restore2 Mini once the pilot had finished. And just coming right up to date, training started this month with the aim of reaching 100 trainers and 5,000 carers of people with a learning disability across England in the next few months, which is something my colleague Sandra is going to talk about in the next part of this session.
Thanks, Jeff. Now we've heard a lot about the development of the Restore2 tool and how it might be beneficial to carers and people supporting people in care homes and out in the community. What we've done in the west of England through the West of England Academic Health Science Network was actually building on the work that Wessex had done with the West Hampshire CCG in introducing the tool. And what we've done was go right at training, introducing the tool by training care staff within care homes, residential homes, domiciliary care, and really anyone who was willing to be trained in it. We even had family carers asking, could they also be trained in this? So I will just take us through a few slides to show us what it was like when we introduced the tool by training staff and carers of people with learning disability and see what they had to say. So, why did we even think it was important, especially for our staff and our carers looking after people with learning disability? Now, the evidence suggests that people with a learning disability do have poor health outcomes, and carers on occasions may find it difficult to communicate with GPs and any other healthcare professional. Now, we also know that many people with a learning disability may have health problems which actually make them more vulnerable to other infections. And of course, we know as well that some of them may have difficulty in saying when they are unwell, and so we want to help families and carers to be their voice. I mean, looking at the statistics, especially from the reviews done by the LEADER program, very recently, the report that came out last year suggested that statistically, the people with a learning disability who died from COVID actually died at a much younger age than in the general population, and that the people with a learning disability are greatly impacted by COVID. So, of course, we feel that carers will benefit from understanding the signs which will really make a difference in this pandemic. So in terms of our training, basically we have two to three simple objectives. One is that we want to help the carers and the families to be able to recognize when anyone they're looking after may be unwell or when they are getting worse, which we also term as deteriorating, using soft science, which Jeff has kindly described to us in his presentation. Of course, we would like people to be able to respond to and escalate their concerns effectively using the National Early Warning Score, which Jeff also mentioned in his section. And then using the SBAD as a structure to tell or to communicate their concerns to the healthcare professionals every time so that they can get the right help for the person they're looking after early. So I just put in a bit of statistics in terms of training for the West of England Academic Health Science Network. Obviously, we kind of offer the training to every care home, residential, nursing, domiciliary care in our patch. And up till date, we've had about 1,216 staff from 163 care providers trained across this region. And of course, like Jeff mentioned in his last slide about us. In February, training carers of people with a learning disability in using the Restore 2 Mini tool. We've actually managed to train 137 of such. And this obviously is a bespoke training package that was commissioned by the NHS England and Improvement Leader Program. The three modules of training that we offer in the West of England Academic Health Science Network is the Mini, the Restore 2 Mini, and the Restore to Full, and then a train the trainer approach. Because, of course, we know that there will be organizations that probably have multiple sites and they might want to cascade the training within the organization. So we offer them that opportunity. For any further information on accessing the training, that's our website address there, and it's pretty much open to any care provider within the West of England region. I believe some our partners in the other regions of the country might have trainings they do offer as well. So we encourage people to link up with their local AHSN to be able to access their training. Next slide, please. Okay, so I thought it'll be nice for us to get an idea of the sort of things we do with people who come on our training sessions. So we kind of I put in two scenarios that we would explore. So let's assume you are a carer, you're a member of staff in a care home, and this might be one of your residents, Charlie, you know, and we will kind of ask people to look through this scenario and to imagine this being maybe one of, a situation they might come across. And then we'll say, okay, you know, let's just try and spot some of those soft signs. What are those soft signs that care staff may identify in Charlie in this scenario? I thought it might be, interesting if you want to give it a go. You know, we know Charlie, we know what's normal for him. But then one morning, the staff noticed Charlie was reluctant to eat his breakfast and he feels the need to go back to bed for a rest. And of course, when staff checked on Charlie an hour later, they felt his hands were colder than normal, and Charlie was beginning to shiver. Oh, and of course, Charlie was like, "Oh, I don't feel well. I just want to go to bed." If it was the staff, what sort of signs could you spot from Charlie? I bet you're probably saying the cold hands, colder than normal, and of course, he was shivering. He was reluctant to have his breakfast. I mean, Charlie is a good eater. He loves his breakfast, but he wasn't having any of it this morning. And of course, that need to go back to bed, that will worry you as a staff member. Now, those are the soft signs that will be the early indicators that something's not quite right with Charlie, that Charlie's gone off baseline, that Charlie is not his normal self. And this will cause you to be worried and want to escalate the concern. Okay, if we look at another scenario, Hillary. Now, this is probably one that might be familiar with any carer supporting anybody with a learning disability. Hillary is 52 years old, and she usually enjoys a good conversation. She engages very well, and she's got a wicked sense of humor. Yeah, there are those other bits around her. But today, staff kind of noticed that in the last 2 days, Hillary's not been herself. She appears restless, continuously pacing, irritable, and rather unlike her, very snappy with everybody around. She seems to have lost the sparkle in her eyes. She tended to have been avoiding much eye contact. Hillary's also been fussy with her meals. She was eating and drinking very little. Now, I bet you're probably saying, that's not Hillary. That's not the Hillary we know. And that's exactly what, the staff supporting Hillary will probably be thinking. So we're saying, yes, these soft signs are already indicating to you that something's not quite right with Hillary, that Hillary may be becoming unwell. It's time for us to do something about it. And of course, staff will be encouraged if there is service that do take vital signs, monitor vital signs, they will be encouraged to use the National Early Warning Score tool to do that and to record the observations, to calculate the new scores. However, if they are not a service that does that, then they will be encouraged to use the SBAD format, communication format, to communicate their concerns to the appropriate person, whether that be the GP or that could be the home manager, could be a member of staff in the home, could be the out of hours service, or could be the ambulance service as well. But these are just the sort of scenarios we get trainees, people who attend our training sessions to work on. Okay, let's kind of go through a few more things about what's happened real life in practice, in terms of, okay, people have been trained, but I thought I would share with us some case studies from some of the feedback we've got from people who have attended our trainings. But before we do that, I'd like us to just quickly watch this 2 to 3 minutes video, hear what some care managers are saying about their experience of using the Restore tool, a tool in practice.
Does get looked at by nearly every professional that comes in.
The feedback from the hospitals has been brilliant. They love them, think it's absolutely brilliant. And again, like I said earlier, our doctor's surgery, they now ask us what the score is. So I think from our experience, it's working really well.
It underpins their feelings. Gut feelings go a long way, but when you actually do the Restore 2, it gives them the competency. Yeah, actually, I did get that right, and I've got the evidence to back it, so I can move things forwards.
We'd usually do what the GPs will call the basic obs, so the blood pressure, pulse, temperature, SATs for general review anyway. But across the whole team, it's really, if anything, I think it's raised confidence throughout the whole team now, because they're documenting it down so usually our senior carer would do our baselines, but sometimes that's not always possible. So across the board now, every member of staff is shown how to do every set of the observations. So every member of the team now takes part in that, and it's really, really good, because it's just making everyone feel so much more confident, and everyone knows how to use the Restore tool. It's brilliant.
Soft signs of the Restore 2 are, in my opinion, more important than the actual readings themselves.
Okay. Is that because that's that first indicator?
It's those first indicators which start to say, do you know what, something's not quite right.
And we had a lady beforehand, we did the Restore observation, the news score, and reported that to a GP who, at the time, this was very early on when we were using Restore, she wasn't overly concerned regarding the results. However, we still weren't happy, so we actually went over and above the GP, and it actually turned out that particular lady did have sepsis and did in the end have to go to hospital. Yeah, that was using her soft signs, because this was a lady that had been with us for about 10 years, and we knew the points of when she was getting poorly, so had those on the front of the form, and it was literally using that to escalate it further and actually, no, we're not happy with that, so we're going with what this form says, and it actually worked really well. The lady did get treatment and luckily came back home.
For one of my residents who's got advanced COPD, working on the soft signs, even though his news score doesn't change, we now know when we can start rescue medications to keep these people out of hospital. So that's picking up the soft signs and normally a stats, which tells us when we need to go in with the antibiotics. On the back of that, he's not been in hospital now for a year, and he was going in every 3 months. Because we could use the Restore 2 tool, we could give them all the information. We actually bypassed all the questions from the 111 team, and it went straight to professional discussion, which means an ambulance was here within 20 minutes to take this particular gentleman to hospital. We are residential, we're not nurses, we haven't got nurses here, so we don't get that straight professional conversations. And it was good to be able to bypass all the ongoing questions which they ask to get things moving faster.
And was that just because you started off with the school and they said, right, we know that needs to go?
I think it's once you start using the Restore 2, your whole conversation changes. You're on a much more professional level, and they're starting to respect that.
You didn't say about your gold standard framework and how you use Restore 2 with that, and how you got really good feedback.
Well, it does. They work hand in hand. It starts to identify when people are moving down the gold standard scales, especially when you're going between green and yellow. I mean, obviously on blue and red, it's pretty obvious what's going on. But when people are on the slip, it gives you the pre-warning that people are on the slip. So we've got more chance to get things in place before we actually get to crisis point. So it gives us a warning to get the GPs in, to check everything's in place, to get the just in case medications in, to have the district nurses primed, so nobody ever suffers. So we just marry the two together.
So, having watched the video and obviously listened to the conversations with those care home managers, now we noticed that obviously some of them were nursing homes, some are from residential homes. Actually, what this is telling us is the Restore 2 Mini and the Restore 2 Full tools can be used across the board, whether you be a residential home, a service for supporting people with a learning disability, a nursing home, domiciliary care. It can be used across the board. So I thought we'll share the examples of the Restore 2 use in practice now. And I've got a few case studies I thought we'll share. Now, these are all from the west of England area. So, and there are people who have attended our trainings. So Fessy House is a residential care home for people with a learning disability, dementia, and other enhanced care needs. Following attendance at training, the carers obviously used the tool to help them to identify deterioration in a resident they felt looked unwell. So, I mean, they are a service that do take a vital signs observation. So they did the observations, they calculated the new scores, and that came up as 7. And they used the escalation plan in the Restore 2 tool to know, okay, we need to contact the ambulance service because of what we know about this person. And this person's treatment escalation plan had already indicated that they are for hospital treatment. So they contacted the ambulance service, and the paramedics actually attended very quickly, and they conveyed the resident to hospital. Now, what the both the residents, carers, and the paramedics have said was that this is really a good tool because the resident was able to be conveyed promptly. The ambulance service were able to prioritize this resident, and they got him quickly to hospital. He got the required treatment very quickly, and the paramedics were actually very complimentary of the home, and they were impressed with the staff because they felt the staff gave them the necessary information they needed to be able to enable them prioritize this resident. And of course, because they got him there on time, this resident had a very short admission, and they were discharged home on time, and they made good recovery. Now, there's another. Let's go to the next one, please. Derbyshire Care. Jackie was a manager that attended our session last year in the heat of the pandemic, and she was so interested in just getting all our staff, trained in the use of the Restore to tool. And she came on the trainer, and she went back to our service. And despite the fact that there was quite a few challenges, because it was in the heat of the pandemic, but she got the support from our managers, to be able to roll out the training as much as she could. The next slide will probably give us an indication of what happened. So in using rolling out the tool to our staff members, unfortunately for them, the home she had decided to start the rollout of the tool had an outbreak of COVID-19. But what Jackie and her team members said was they found the tool really helped them. It came in very handy, despite the fact that they were in the middle of a pandemic, because the staff were able to recognize those soft signs quickly, and also use the news component of the tool to be able to monitor people's deterioration and get people the right help they needed. Funny enough, Jackie herself ended up having COVID-19, but whilst at home, the agency staff who were kind of covering the shift in the home, Jackie was able to talk them through how to use the Restore to getting them to do all the observations and monitoring the people regularly. And they were very, they said they found it really useful. They were very glad they did that. One thing that Jackie mentioned was that most of the residents that they were looking after, they didn't have the common symptoms, the usual symptoms. Most of them did not have a cough. Often they didn't even have any temperature or fluctuating temperature. But the staff just knew something's not quite right. These guys were not right. So they used the Restore tool to support their judgment, their clinical judgment, their intuition, and they went, with their gut feeling, and they were able to pick up very quickly, especially with residents that have very low level of oxygens in their system. Using the pulse oximeter, they were able to quickly pick up, and silent hypoxia did not beat them. Rather, they were able to beat that because they got those people the required help very quickly. Okay, next slide, please. And of course, she just shared with us also some of the other strategies they had, they had employed, kind of monitoring, everybody regularly through a spreadsheet, and that helped them to prioritize people. They color coded it. They were able to, get those people who were unwell, who were more unwell, with the high scores. They were able to get them the help quicker, and they got the quicker attention. And she said that tool was a lifesaver. She said it's a no-brainer, and I thought it would really be nice for us to, kind of share that with us as well. And of course, since the staff have been trained, they are now beginning to really embed the tool in their services, and they are hoping to carry on and share it out amongst other staff as well in the other homes. Okay, and our final case study, which I thought will be good for us to share as well, is one from Bath Road. Bath Road is a Milestones Trust residential home for people with a learning disability and additional mobility issues. So the staff haven't been trained at recognize that one of their residents, Henry, that's not his name, obviously, it's a pseudonym. And this resident had suffered with aspiration pneumonia on numerous occasions before now. But the staff now quickly realize that, okay, so this person is beginning to show them the signs that they are unwell again. Now, in previous times, what they would have done was straight away, they are cutting Henry straight into hospital, and, Henry will have a long stay. And from what the staff were saying, most times by the time Harry is coming back, he's coming back with some additional problems as well. But this time around, once they were able to quickly pick up on the soft signs that Harry, was becoming unwell, they were able to take his observations and communicate very quickly with the GP using the SBAT structure. And the GP was able to prescribe the required antibiotics very quickly, and this was delivered to the home on time as well. And the outcome was very positive for Henry and for the staff, because Henry got the care he needed on time. There wasn't that need to admit him to hospital as they normally would have done before, because they wouldn't have recognized quickly, or they wouldn't have recognized on time when he was unwell. But this time around, they were able to recognize very early on when they saw those soft signs, and they got the GP in, quicker. And Henry was able to, be nursed in the home, in the comfort of of the home, and with people who really knew him. And he didn't need to go into hospital like you would normally do before. And even if he had ended up in hospital now, they were very comfortable, and they were very convinced that Henry was not going to have spent a long time in there, because they would have got him there quicker. So I kind of thought it would be good to for us to obviously share some of these case studies. Next slide, please. And these are obviously some of the reflections from the homes. I mean, you can hear Jackie's own there. That's Jackie, and it's like, it's a no-brainer. I will highly recommend this to any home. But I think it all starts from the fact that staff were trained in how to use it, because unless people know what to do and how to do it, sometimes it might become difficult for them to do things exactly the way they need to do. And that's why we're offering the training to any care home, or any care service, any care provider in the neighborhood. Of course, that is Becky and Janet from the Milestone Trust. Now, interestingly, I thought I will put in the feedback or the reflection from Chris Turner, who's the GP that was supporting Fessy House. And I mean, Chris Turner is an advocate of Restore too, because he said, look, the news component really does help us to know exactly, I know how to prioritize. The GP knows who they need to see, when they need to see them, what advice they need to give to the home. And if they need to convey anybody to hospital, they know who needs to go in and who could do with being, treated at home. And he was very complimentary as well. I think the whole thing, that's coming out from all these reflections and case studies is the fact that people are able to get the right care at the right time, in the right place. For some people, that right place will be the home. For some others, the right place might be the hospital. It's them getting it in the right place and by the right professional. If someone needs to be seen by the GP, then they get seen by the GP. If they need to be seen in hospital by a consultant, then they get seen. It's about allowing people to get the right care at the right time. So that's how we found it, in terms of on the ground for the homes that we've been supporting and we've been training. And like I said, the training is obviously available. I'm going to kind of hand us over now to my colleague Louise.
Thank you very much, Sandra. What amazing reflections from your nurses and carers there. Fantastic. So my name's Louise Kane, and I'm the nurse educator for North Central London. And I'd like to tell you about a project that we were involved in, which is using digital solutions to support care home staff to spot and act on early signs of deterioration. Next slide, please. So a little bit about the project aim. So we were working with University College London partners who are part of the AHSN networks. And what happened was that the UCLP initiated a programme to improve the ability of non-clinical staff to recognise and escalate and communicate the early signs of deterioration. And we had two complementary innovations. One of them was Significant 7, which looks at soft signs, and the other one was Wazan, which is a piece of digital kit, a telehealth solution, which can support staff to take observations and News 2 scores. So the reason that North London wanted to be involved in this bid, because in 2019 we faced particular challenges that some of you who are listening to this may well have had as well. We had A&E attendances from our care homes were 5% higher than the average London benchmarks. And we had a higher proportion of acute admissions with things like influenza, pneumonia, falls, and urine infections. And of course, these activities then equated to avoidable NCL activity between 1 million and 4 million. So we really wanted to look to see what this digital kit could do to support that. So maybe what a good thing to do is to have a look at the kit in action so you can see it. So if you would like to watch a video, which we're just going to show now.
Blood pressure is 121/67. Your blood oxygen is 96%. Your pulse is 60 beats per minute. Temperature is 36.4 degrees Celsius, 97.5 degrees Fahrenheit.
So I'd like to say thank you to our resident and the care home staff who were in that video. They did a brilliant job. But now you've seen the video and you've seen the kit in action and you understand what it does. I think it's important as well to see some pictures and understand what else it's got on offer. So you could see that it automatically did a News 2 score, calculated it for the care staff. And it can then produce an online chart, or you can print that off if you're having to send it to your GP or if someone's having to go into hospital. But the tablet is also able to do the S-bar, so people are able to use that when they're trying to communicate with other professionals. It also has a COVID-19 document that you can do that proved really helpful during the COVID waves. And it's got falls and musts, and you can add people's weight and a head injury. It's also got a brilliant camera on it, so you're able to take pictures of a wound, or indeed, as it suggests here on the slide, if somebody needs to see podiatry or the dietitian, and you can send it to them and they can have a look at it. And this has proven to be really helpful during COVID. Next slide, please. So let's have a look at our case study of our Barnet care homes that we put this into. The key here is that all three of those homes wanted to be involved. No one was forced. So first of all, we had a large nursing home called Lady Sarah Cohen. We then had a learning disability home, which was Brookside, and they had a CQC rating of outstanding. And then we had Elmhurst, which was a smaller residential home for older people. And what we did with the support of UCLP is we give an introduction to the equipment for WASAN. We supported them with the early signs, soft signs of deterioration. And in Barnet, they had previously rolled out Significant 7. So 2 of these homes had already had training in that, which proved very helpful. We showed them how to use the News 2 score and what that meant and when to escalate. We give them ongoing clinical support. So we offered weekly phone calls, and we would come to the homes if they needed support. Most of the support was around respirations and staff getting just to understand how to do respirations. And if anyone's on the call and can remember when you were learning respirations, it was a bit tricky and it took a bit of time. We also did some feedback sessions, and we got the 3 homes together. This is obviously pre-COVID, enabled people to talk to each other and learning and what they'd done and what they'd learned, and that really helped embed it into the homes. Next slide, please. So in the people who supported the homes in Barnet, we had one nurse educator who was myself, we had a GP who was supportive, and we also had one of the quality advisors from the local authority. All 3 of us who were involved in this were used to working with and knew a lot of the nursing homes that were involved in this, in residential homes. So let's see what happened in Barnet following the implementation of WASAN. Well, it was absolutely amazing. What we got back is that staff felt more confident and increased job satisfaction and enjoyment. So we saw staff talking about, actually, I know more and I'm able to tell more and understand more, and I've managed to add a little bit of my jigsaw puzzle. I've got another piece to it. Residents were much more involved in their care. We saw much more person-centred care because residents loved WASAN, that it talks back to them. So they became involved in that, and they reported back that actually this was fantastic, that I understand what my observations are. And what also happened is that we had relatives really liking this, because they said that they felt much safer when they knew that if their loved one was becoming unwell, that there was a piece of technology that was in the home that could take recordings, and that would directly go to the GP, and the GP could have a look at it and give advice. The care home staff reported back that they felt that they were communicating on equal terms with other professionals, so people were listening to them more. So before they knew the soft signs, they knew exactly what was a matter with people, but they say sometimes professionals wouldn't listen to what they're saying. Very similar to what we've just been hearing earlier on there. And they also said that they got quicker support and advice from all professionals when they called to give a News 2 score, and that they'd taken observations. But quite interestingly, what we saw was increased staff retention. So staff stayed in their jobs longer, and they reported back this was because they had learned a new skill and they felt much more valued. But of course, there's the big thing about what did it do related to reductions. So we saw a 50% reduction in 111 calls. We saw 30% less GP visits, and we saw 20% of ambulance calls, bearing in mind this was just from 3 homes. Obviously, during COVID, these 3 homes have reported how helpful this piece of kit's been. Next slide, please. So don't just take my word for it. Maybe come and listen to what other people have got to say about it. I think here, one of the key ones, there's a couple of key ones I just want you to have a look at. One's about a resident who lives in a learning disability home, and he was quite frightened of going to his GP, and anything medical really quite upset him. But once he got to see the blue box, and he'd used it a couple of times with his WASAN, what he said was he felt that he was more of control of his own health and aware that when the staff would have to phone the GP, and that the GP could look at his observations and wouldn't necessarily have to see him. And for him, that was a big win. And the staff reported that that was really helpful for them as well. And then, as I said earlier, it's about families and residents feeding back about the system, and just about how impressed and reassured they were that they had this kit in place, and that care, and if they needed any extra support, it could happen. And also, similarly to what we've been hearing earlier as well, when the paramedics have arrived in the homes, they've also reported back about how they found the kit really helpful, and that they had lots of information before they arrived. Next slide, please. So let's have a listen about what the GPs have got to say. And what we got from the GPs is that they really liked it, because when they go to do their reviews on their electronic records, it helps them with their long-term conditions, with their QOFs. and management of acute illnesses. And one GP's reported back to us it was like having a second pair of hands in the care home. And he also reported that it was invaluable because the home and how he and the home worked greatly improved. And the embedded, and I was just speaking to him not so long ago, and he actually said that actually it's got even better when COVID came. So next slide, please. So what we did, we obviously decided on the back of this, actually, we wanted to upscale it, the digital technology in North Central London, following our successful pilot. And we won significant funding to roll out more remote monitoring into 125 care homes. And so we just feeding back on the lessons that we learnt. It's imperative that you have good working relationships and engagement from the whole of the multidisciplinary team before you start. Make sure that you're asking homes and GPs to be involved. Don't force anyone because it doesn't work. Do comprehensive inductions both for the GPs and for the homes so that they understand what is going to happen, the timelines and what's expected from both ends so there's no surprises. We learned that having a nurse educating team, to have a set of nurses, was really helpful to do the training. And on the back of that, we've employed 5 nurses to roll this out across North Central London. And the key with having the nurses is that they're able to be responsive to other training needs in the homes. So we've been into homes and we've spotted that actually they've maybe had quite a lot of safeguardings, or they're struggling with something like urine infections or indeed catheters. Lots of people during COVID were discharged with catheters and staff had never seen catheters or looked after with anyone before. We were able to be really responsive and put that training in very quickly and support them. Also, when the nurse education team go in to do their training, they tailor it to the home and what the home wants. So no 2 training sessions are the same. We're very flexible about the training, what time we do it, how we do it. At the moment, we're doing a lot of virtual training, but we have been in homes that have requested us to go in when it's safe to do so. We've also now set up some super users, so we train up and sign off as competent about 3 or 4 staff in the home who then train other staff. And this has seen a real increase in confidence within those super users. And in fact, in some homes, a bit of a fight to say who's going to be the super user. We'd like to support to increase the digital capacity of all the homes that we're working with. And we've also got a clinical lead who's a GP. And I think that often clinical leads work really well with GPs, to listen to GPs and what their concerns are and for us to all work together. So thinking about that, what's our aim in North Central London? Well, we want to support all of our providers to improve their digital capability and capacity so that we're able to improve the digital pathways and allow GPs and other services to provide care. But the key thing here is that it's going to be centred around our individual residents and their locations. And this, we hope, will improve their health and well-being. Next slide, please. So here's the contact details. If you want to know more about the project, or if you'd like to drop us an email and say hello, we'd love that. And I'm now going to hand you back over to our colleagues who are going to talk about the HSN network. Thank you.
Thank you very much, Louise. There are 15 AHSNs around the country, and each one hosts a patient safety collaborative. These are the links you'll see on the page. If you've got any questions about what's happening in your area, these are the links, and they'll be able to either answer your questions directly or put you in contact with the relevant people. Next slide, please. There are also a number of resources. I referred to them earlier. They're all available through the AHSN network and the website. Thank you very much for your time today.